Good evening and welcome to our Pandemic Relief Series seminar. My name is Dr. Cheryl Lee, and tonight I will be presenting on economic concerns during COVID-19. Last semester, we did a series and I presented on economic concerns having to do with COVID-19 and how to manage and budget your money, personal finances. Tonight, I will be speaking to you about the effects that COVID-19 has had on the economy and the types of relief that there are out there to assist with the impact of COVID-19. Right now, as we see COVID-19, it is a pandemic that has caused devastating loss of lives to the nation. And it's not only a global pandemic, but it's also a public health crisis and has also created economic hardships on households, businesses, families, globally, worldwide, the U.S. nation. Everyone has been impacted on this. And it's been severe. The economic impact has also impacted the global markets, the financial markets, the stock markets in question. And it's right now remaining volatile with just having a lot of uncertainty. And because of this, we see there is a significant rise in unemployment, disruptions in transportation, service, education. Students are not in school. Alternatives had to be used in terms of how to educate our children, entertainment, sports, the manufacturing industries. These are all having negative impacts when it comes to dealing with the virus. As such, we find that the larger economic problems tend to be having to do with gas. Gas prices are going up, and because gas prices are going up, this will continue to increase when it comes to the cost of daily living expenses. And as we know, whenever there is an increase with gas, everything else also goes up. We have increase in food, there's increase in transportation, cost of living, rent, mortgages tend to go up whenever the price of gas goes up. So the rise of gas prices, we see that right now, we think gas prices are at $3 something where I am per gallon. And it was about like a couple years ago, lower than that. And so it continues to rise. And this will have an impact, a significant impact, because with unemployment, not having a job, reduced hours, and gas prices going up, it will significantly impact our daily lives as we move forward. So we see where we have our demand. It is still high, or we do have that demand for gas, and the supply, it's low. So demand is going up and it continues to remain stagnant or the same as it was prior to the virus, but the supply, it's low. And this we see with a lot of things that are going on with COVID-19, where demand is at the same level or even higher than before the virus. However, the supplies are low, and this is impacted by trade, a lot of stuff going on. For example, if you order anything that's made in another country, for example, bikes, I know last spring, summer, I tried to get a bike so I could do outdoor riding, and I could not get a bike. They were sold out everywhere in Walmart, Walmart, Target, everywhere, the bikes were sold out, and there was a lot of demand for bikes. However, there was not the supply, and that had to do with just borders shutting down, countries shutting down, and the suppliers, manufacturers, not being able to supply us with the bikes that we needed. And so I wasn't able to get my bike and ride for the summer in spring of last year. And this is what happens when we are in the middle of a pandemic, or we go through a pandemic, a global crisis such as this, nationwide crisis, and the impact on everything when it comes to trade, the economy. Next slide, please. So with COVID-19, the economic impact, we'll see change in work in terms of how we are working. We see a lot more people are working from home. We see that the tourism, there's been changes there. The tourist industry took a big hit because people had to stay had to stay home, less traveling, less use of hotels, and transportation workers. The people that work in offices and are able to work from home, they could still maintain or can still maintain their jobs. However, with this, it also comes those that are not able to work from home and they have to work outside of the home, that this has impacted those jobs as well. For example, construction workers, there were stop orders, or they had to stop work, cancellation of maybe contracts and work. And again, this goes back to where this affects income coming into the home, because with cancellation of contracts and jobs, reduced income, then this affects the day-to-day or weekly, bi-weekly or monthly paycheck of households, and bringing in money to support and feed families. And so this has been something that is a concern. We see where we're adapting with work, we're trying to adjust, and some people, the ones that are not able to work from home, they are having a difficult time, and that also contributes to the high unemployment rate or reduced hours of working. Again, as I said, this results in households significantly struggling financially more and more every day. As the spread of the virus continues to disrupt economic activity and negatively impact our manufacturing and service industry. Remember, I gave the example of the bikes and getting supplies to us. Remember back last spring, there was a shortage of sanitizing products, hand sanitizers, Lysols, toilet paper, paper towels, and that as well, it was due to not getting the supplies to the stores, and everything. We're like an ecosystem. We tend to depend on each other. So the manufacturers, they depend on transportation to get the goods to us, and transportation, they depend on gas, they depend on whether it's by air or sea. It's a lot of to factor in. And so when one structure falls, then the other tends to fall, like a domino effect, affecting and impacting our economy, and leaving us not able to get the needed supplies that we need to function on a day-to-day basis. And I know a bike may not be something that we need on a day-to-day basis, but for food, in terms of food supplies, medical supplies, those sorts of supplies, if when our economy is impacted negatively, then it affects these areas, and it makes it very difficult and brings a lot of stress into our homes and families. Here we have family stress, we have personal stress, and it's just a lot of stress. And so it becomes a very difficult time to try to figure out how to get through this crisis. And we haven't even touched dealing with the virus itself. If we're in a home where families have contracted the disease, and then they have to deal with that medical care, medications, and it's just been a very, very negative and impactful time where households are concerned and families are concerned. So as I said, as the disease progressed and we come up with ways to try to combat this virus or contain the virus, we see where the pandemic will have a lasting impact on the economy with regards to both short and long-term financial and economic concerns. And with that, I will give you a list of some of the economic concerns, aside from the ones that I previously mentioned, that have been trending a lot. This list, it's not a definitive final list. It is just some of the things that I have seen that are significantly impacting our economy. And then I will give you some solutions or resources on how to deal with these impacts. Next slide, please. So some of the economic impact of COVID-19 that we see small business revenue is down by 20% since January. And with that, because of the virus, small businesses, we've seen actually within the last year how a lot of businesses have been closing, because you find when it comes to retail, not a lot of people are spending or shopping. And so businesses are struggling to stay afloat, small businesses. And so their revenue, it's down. We have only Chapter 11 bankruptcies have increased relative to 2019. And the reason for that, again, spending, it's down. I guess people are not racking up bills because of not having enough to spend. New business formations have fallen off. There are significant layoffs and shutdowns, which are driving people's household in terms of income and the number of hours that are being worked, and just not having a job. The number of labor force participants, people that are not working, that do not have jobs, have quadrupled within the last year. Next slide, please. Also, the number of people in the workforce who want a job and are looking for jobs, it has spiked, and that has remained very high within the last year since the beginning of the pandemic to present. When it comes to personal savings, in terms of people saving personally, having money in their savings account, this has reached a record lowest level since we came out of the Great Recession back in 2008, 2009. and that is because of loss of jobs. And so there are limited funds, and people are not saving as much as they were prior to the beginning of the pandemic. Also, we see that there are low income families with children. They are the ones more likely, not definitively, but they are the ones more likely to experience a shock when it comes to income shock, because say, for example, you have a single mom and she was working 1-2 jobs, and then in a small business, and the small business closed down. So now she doesn't have a job, and she has a few children. And so that income as the breadwinner for that household, it has stopped. And so now mom is trying to figure out, how am I going to make money? I'm, in the category where I'm looking for a job. I want a job, but the job is not there. The jobs are not there. I've been applying, and no one's calling. I can't get a job. And so the income has stopped in that household. Mom is unable to save, because say she was saving when she was working. She's no longer able to save as she could when she had an income, and she no longer is able to sustain her home with her kids in terms of buying food, paying rent or mortgage, utilities. And if one of the kids or herself gets sick with COVID, she may have issues with having health care and paying for medications that may be needed as a result of other underlying issues, not directly COVID, because we know that they don't really have a treatment for COVID, just trying different treatments. And so to help alleviate some symptoms, mom may the doctor may prescribe other medications, and mom may not be able to afford it because maybe not having health care, not having enough coverage for her and the children. And this is just a scenario that I'm given that happens and can happen, and actually has been happening since the pandemic has started. Another trend that we're seeing when it comes to COVID-19 economic impact, it's that in over half of the 50 states, more than 1 in 5 households were behind on their mortgage or rent. And some states, they have implemented assistance, or they implemented a stop order for landlords where they cannot evict tenants, and mortgage companies, they have been helping. However, I know certain states that will be expiring. So once those guidelines expire, then the families with the rent or mortgages, back rent, it's going to be a problem, because I know for the mortgage, they want you to, if you put in for a forbearance, the forbearance, it just delays your payments and for your mortgage, and then you would have to come up with the entire, if you did a forbearance for 2 or 3 months, you would have to, at the end of that forbearance, pay the entire mortgage for the 2 or 3 months. And if we have a family that has lost income or reduced hours, and they're struggling to pay the rent and to find food for 1 month, it's going to be problematic to find it for 2, 3, 4 months. So this is going to be an issue within the next few months that we're going to see. I'm not sure how the state or is going to handle these issues, but we just have to wait and see moving forward with that. Another trend that we're seeing is the rate of insecurity when it comes to for food. That has increased. And what I mean by this, when I say food insecurities has doubled in households, it means that people are struggling. They're having a hard time putting food on their table. And so if your basic needs are not being met, your shelter, you're struggling to pay shelter, or you're worrying about how you're going to pay for your shelter, and you're not able to provide food to your children, your families. This is, again, a significant impact on us, on families, on individuals, not just with children, but everyone. And it is impacting, it's right across the board, nationwide, as well as globally. Next slide, please. Okay. So with that said, there are some ways to help to relieve these economic impacts that we're having with COVID-19. All is not lost. What I say is to go out there and to seek help. Don't be ashamed or afraid to ask for help, because at this time we're in the middle of the pandemic. We probably have another year and a half to go for things to settle down a bit with the vaccine coming out and normalize. So with that, there is assistance out there. As I said, there is assistance for small businesses. You can go to the Small Business Administration website, check out sba.gov. They have the Economic Injury Disaster Loan Program, EIDL. And if you have a business, if you are a small business, that is a recourse for you to go out there and explore putting in for that economic injury disaster loan. If you have employees as a small business, there is also the payroll protection program. And it's also through the Small Business Administration. As you can go on sba.gov to find out more information on that, how to put in your applications. And this can provide some relief for your small business and to help to keep it afloat, so you don't have to close down. And so I encourage you to go out there on SBA, Small Business Administration website, and see what is available to you. There's also COVID-19 relief grants through companies such as Walmart, Apple, Amazon, a host of other companies. They have grants out there. Again, you could do a Google search for grant relief, COVID-19 grant relief or relief grants through businesses. And you can put in your application for grants. Grants you do not have to repay, as opposed to loans. You do have to repay loans. With the Small Business Administration, the PPP loan or the economic injury disaster loan, the interest rates are very low. I think it's 1%. And that's the lowest that you could ever get. So if you are considering taking out a loan for your small business, I would recommend going through the SBA as opposed to a bank or any other financial institution, just because of the interest rate. And at this time, the SBA, if you take out a loan to help with your small business through the SBA, then your repayment does not start until 2022. There's also aid to unemployed workers. You can go and file for unemployment through your state. Make sure you are putting in for your unemployment each week. You have to certify that you are looking for a job and that you are not working. You put in for it once you get approved, and you will get your unemployment from your state. The amount depends on how much you've worked for the year based on quarters, and also your state, it determines the highest. So if you're in a high paying job, there is a cap on the state, the maximum that you can get for unemployment. I'm not sure if there is a minimum, but check with your state unemployment office to see. You can also go on the website and make sure that you are certifying each week so that you can get your unemployment and help to assist you during these hardships. Next slide, please. There's also aid for households, and some of these aids, as in more ways for COVID-19 economic relief. There is the SNAP food stamp program. Again, go through your state and state office, local office. The 800 number, you can call toll free for information, as well as you can go online to get this information on how to put in your application to receive food stamps for yourself and your family. There's also the Food and Nutrition Services Program, which is different than the SNAP food stamp program. You also have your local community, churches, food banks, co-ops. Please, your local social services agency, you call them up, you can get a list of where the co-ops and food banks are, and you can go out there. Oftentimes they are not requiring you to show any proof of or loss of income. They have specific days for the co-ops and food banks where you can go to pick up food. If it's like, for instance, one church or food bank may say, we distribute food on Tuesdays at 10 a.m. and Thursdays at 1 p.m. and you go, and the amount of food you get is based on family size, can be based on family size. So please utilize that resources. Call your local social services agencies to find out, to obtain that list, because they're usually a good resource as well that can point you in the right direction on where to go and how to obtain food immediately. If you did apply for food stamps and you are waiting for your application to be approved, the local food banks and co-ops, that's a great way for you to not go without food and be able to feed yourself and your families. There's also WIC, Women, Infants, and Children, and that program provides milk, eggs, cheese, cereal, juice for pregnant women, babies, and small children up to age 5. Again, you go through your local social services offices. You can also go to the hospitals in your area to apply for this service. You can also, if you have a primary care doctor or pediatrician for your children, your OBGYN, you can inquire about this service WIC from them, and they will give you the application. You can put in the application for it, and you can go, and it's nutritious. It's and you can use it. I used it way back when I had my son, And so I'm not ashamed to say that it was available to me. And it's very good. It's a very good program. And as I said, for pregnant women, once you have the child, the baby, then they also give you formula for the baby. And once the child gets off formula, then you can get milk and juice and eggs and cereal for your kids up to age 5. So this is a very, very good program to utilize. I utilized that program way back years ago. And I recommend it to anyone. As I said, do not be afraid to ask for help. It is out there, and you can go out and seek it. There's also the National School Lunch and Breakfast programs for your kids. And you can, if your kids are not back in school, they're still home, please call your local school district to find out about these programs and how you can get your kids to obtain their breakfast and school lunch. And they will give you the information. Call your local school district. Again, you can also call your local social services agencies for this information about the days and times for the kids to get breakfast and lunch. Next slide, please. So in conclusion, to give in some ways for relief, economic relief, when it comes to COVID-19. We see where we have been left turned upside down for a little over a year now, and it's still ongoing. We've had to learn to adapt. We've had to change the way that we work, the way that we assembly, the way that we socialize with our families and friends, co-workers. And it has been a very, very big change for all of us. We see where the pandemic has us going through our priorities, prioritizing on different things. More so healthcare and just survival, and our capabilities and outlooks may be changing because of this. And so the COVID-19 pandemic has created a new normal for us and has thrown us into a new sense of urgency. With fighting this pandemic, it will take a collective effort from us, meaning as individuals, as families, as co-workers, as friends, as a nation as a whole. It is a collective effort globally. It's impacting all of us, and therefore it is not going to just be one person or one sector of society that has to fight or to combat this virus. It is going to take a collective effort from all of us to combat this virus or contain this virus. So with that, we want to continue washing our hands, wearing our masks, and continue with our social distancing. Educate ourselves when it comes to the vaccine, and do your research. And from there, you make an informed decision on whether you will get the vaccine. And when it comes time to get the vaccine, you go and you get your shot. I believe the vaccine, it is a personal choice. It's a personal decision. One thing I will say before you make your decision, please educate yourself, do your research, and see what is the best recourse for you and your families in terms of taking the vaccine when it comes to getting vaccinated. And with that, we are resilient, and we have been getting through this for the past year. We will get through this. It's hard economically, medically, personally, financially, but we are still standing. We're still here, and we will get through this. Continue to be safe and be well. So thank you for listening to this presentation on behalf of the United Way and Knoxville College. Again, I say thank you for tuning in. And if you have any questions, please comment in the box below, and we will get back to you. Thank you.